Oh, thank you.
We're gonna have to lay down and rest.
Kathy, I don't know if you were saying thank you for the recording or not.
Oh, sorry. I didn't realize I was on.
That's
I thought
okay.
it was muted. So
I was-
sorry.
That's okay. I was just gonna say you should be used to this already, being a famous movie star.
Oh, dear Lord. Did you see that?
I did, and I gotta
I'm
be
so
honest.
sorry.
No, I loved it, especially that I guess it was your husband that threw the ball at your head.
Oh, he was actually kind of sad that it didn't take more takes.
Well, he did a good job throwing it at you, and you did a good job taking it. So I think
And he enjoyed every second of it.
okay, so I've started letting people in. We still have a few more minutes, but if you guys can make sure that as you're coming in that you're on mute. And let's see. Still have a few people joining us, so we have another minute and then we will get started. Lost the. Okay, so for those of you that have already joined us, if you'll take just a minute and put your name, your first name, and the county that you are residing in into the chat box. We're using that to take attendance, but then also we will be moving into breakout rooms here in a little bit, where you'll have an opportunity to meet your network hub representative. So we want to make sure we put you in the right spot. So if you'll take a second and put your name and the county that you're in the chat box, we would greatly appreciate it. Okay. So by my watch, I'm showing it 6:30. So we will go ahead and get started. So my name is Rebecca Quigley. I am the Quality Initiatives Program Manager with Child Care Aware of Kansas. Like I said, we are going to be moving into breakout rooms here in a little bit. So if you'll make sure that you put your name and the county that you're with into the chat box, make sure everybody is on mute. Doesn't take much to distract some of us, so the background noise on mute would be appreciated. There is also, Kim, if you will drop it in the chat box again, because I don't think everybody has seen it, but there is also a link to a Google form that is being dropped into the chat box. If you'll take a minute and fill that out for us as well, give us a little bit of information that we use in our reporting for DCF, but I am going to go ahead and share my screen here and then turn over to Chris Nicholson, who is our Quality Initiative Senior Program Manager, and she is going to share some information about network hubs and shared services this evening. Maybe she'll share with us this evening. I don't know. We'll have to see.
I thought you were doing introductions and other things. So, all right, no, I'm ready. There is somebody that I'm noticing in the chat box that has not put their county. So please be sure that you
Do your Bluetooth.
that really helps when we when Montana goes to separate folks out to the breakout room. So, all right, well, welcome. We're glad you were able to join us. I know that.
No, I cannot.
Speaker is on.
I'm not doing a Bluetooth.
Connected.
Oh, I guess I was on mute. I'll get it figured out here in a minute. Anyway, welcome tonight. I know that things are really busy in your lives, the beginning of school, the end of summer, a lot of stuff going on. So we're glad that you're taking this time to meet with us this evening. So go ahead, Rebecca.
Am I sharing my screen or, oh, sorry.
In progress.
So many of you have probably seen this, this graphic before. This just gives you an idea of what CCQIS is. That may be a term that you've heard. Some of you were involved in our CCQI project, our Child Care Quality Improvement Project. And now we just added an S to it. So it's Child Care Quality Improvement Support. It really, this project has 3 prongs to it. One being the links to quality, which is our QRIS system here within the state of Kansas that's being developed. Our regional community consultants, which those are the folks that will be facilitating the breakout rooms today. And hopefully many of you have been able to connect with them. If not, we hope that you will. And then our shared services, which is what really is going to bring us here tonight, because we are getting ready to launch that. So this is a map. Hopefully all of you have seen it. This gives you the 8 different service areas where our, oh, this is the links to quality. I'm sorry. So links to quality map, we have a lot of maps. Rebecca had mentioned, well, we will have a shared services map. We have a links to quality consultant map, and we have our regional community consultant map. Unfortunately, not all of them align as far as, you know, county to county, but we're trying to get them as close as possible. So if you are interested in links to quality, if you haven't gotten connected with that group of consultants, that map is on our website, and it will also link you directly to that consultant that can support you if you want to work on those, on the links in the quality rating and improvement system. So this is just gives you an overview of what the continuous quality improvement is for links to quality. I saw a few names on here that were involved with links to quality way back when it was the pilot phase, going through giving the consultants input on how that would improve. And what the links to quality is, I have been mentioning several times, it is our quality rating and improvement system. The first link that you have might have already worked on. If not, if you're interested, it is our program administration support link. The links to quality team really felt like this was the basis for all foundation for childcare programs, whether you're a family childcare program or a childcare center, you need to have a strong business foundation, and they can help you with that. So the first 3 links that they're working on, as I mentioned, was the program administration. They're currently also working on the family partnership and health and safety. And they have a lot of, the learning development is under construction. I know there's a few others that they're working towards, or at least kind of in that brainstorming. If you have not heard about the registry that's going to be launching here later this fall, if you are involved in links to quality, there is a cohort of providers that will be involved in that first launch for the registry, kind of being that guinea pig group. So that'll be, we'll let them go through that, kind of work out some of those kinks, and then the rest of us can jump onto that. So as I said, if you see RCC in front of somebody's name on the screen, that means they serve as a regional community consultant. Just like when we worked with our Child Care Quality Initiative, our CCQI, we are regionally located. Many of you hopefully are aware that Child Care Aware of Kansas has 4 different resource referral regions, and we really lean heavily on that regional approach. So the regional community consultants are all located across the state in the regions in certain areas, counties, because we really like to have them embedded in that. Regional community consultants are there to help provide technical assistance on anything that you need. They can provide resources. They are there to help you get through the child care management system, the software systems, and just there at your whatever you might need. So we hope that if you have not been able to join a regional community consultant for the monthly learning community meetings, we really encourage you to do so, because that's where a lot of conversation about our shared services, our child care management systems are going to be are taking place. So this is the regional community service areas. So as you can see, there's 8 of them. And again, because we go along our childcare resource and referral lines, you may, if you're in the Kansas City area, you work with the Family Conservancy. Those are the 4 areas that Tamara covers in Service Area 8. Service Area 5 is Child Start. At this time, Ann Gaskin is serving as the regional community consultant as they search for someone to fill that position. So those are the 5 counties that she serves, and you can again see on the map. And if you go to our website, that map will also show you at the bottom who that regional community consultant is, and it'll provide you with a direct link to their email so you can connect with them. So as I've said, that the learning community meetings happen on a monthly basis. They really are driven by providers. The regional community consultants reach out to those folks that are have been participating or interested in just what are your needs. It can be a time to talk through struggles or successes, or what kind of trainings are coming up, or I need a resource about this or about that. And then again, kind of our focus for the next few months, the previous months have been on the childcare management software system, and upcoming, it'll be a lot of conversations about the shared services. So shared services, what is it? I know you've heard this buzzword a lot. I will be honest with you, we're kind of learning it too. It is a new kind of initiative that's going around the nation. And what it is, I like to kind of think of it as, you know, a co-op where we have services that we can offer to you through our network hubs that'll make your life easier. So you will have input when we get into our breakout rooms as far as what your needs look like. That you would, what is the need that shared service hub can provide to you. So it, you know, it could be up to 2 or 3 shared services as we move forward. It could be more as we determine what, again, what your needs are to make your business practices run more smoothly, some seamless. You don't have the funds maybe to do a certain service, and that so you come together as a group and kind of that power in the group, the numbers that we can hopefully offer those to you. So as Rebecca had mentioned, or maybe not everybody was on the call, this is not an exact map. We do need to do a little tweaking. There are some counties that aren't in the right location, but we will have an updated map, hopefully by the end of this week, if not the first part of this week. So you can see at the bottom, and we have corresponding colors. So when we start from the Northwest area, that's the shared service network hub representative will be Dana Stanton from Northwest Kansas Economic Innovation Center. And many of you may have already been working with Dana in regards to a lot of other initiatives that they've been offering up in the Northwest area. Down in the lower left, and our comms person, our communication person, Desiree, whenever she puts maps together, she always knows I like to be associated with purple. So she made all those Northwest counties purple, which always makes me happy. But Child Care Aware Kansas will be managing those counties and the shared services in those areas. Up in the green, up in the northeast area will be the Community Children's Center, and Kim Paulson will be the network hub rep at this point for that. I know a lot of the network hubs are also beginning the process to hiring network hub managers. And then in the southeast area is our Child Care Aware of Eastern Kansas. And at this time, Talia Juliana Myers is the network hub representative. And then Family Conservancy again in our Kansas City area. And Mary Williams at this point is the network hub representative. So what do shared services offer? You know, shared services network, and there's a lot of different terms going around, but the shared service network is a group of providers that are part of the hub. So you have a network of providers coming together to kind of provide input and feedback in regards to the services that the hubs are going to offer. So the Shared Services Network Hub is the lead entity, those folks that I just reviewed on the previous slide that shows where they're located and what their names are at this point. And they're going to assist you when we get into the breakout rooms and beyond on what are your services. I mean, what are the services? Identifying common needs, and then being able to facilitate agreements, excuse me, with service providers within their areas. Hopefully, all of you are aware of our child care management software, the CCMS. We've had this launched, let's say June. I think it's August now, so maybe June, maybe May. But hopefully you all are aware that for the next 14 months, you can have a free subscription to either Brightwheel or Playground. And I know that a lot of providers have reached out to their regional community consultant for technical assistance on that. If you like more information about it, we do have some on our shared services page on our website. It'll give you a flyer in regards to, if you are looking at Playground or you're looking at Brightwheel, it gives a comparison document and then some frequently asked questions for that. But if you do have any questions currently, if you're, you've kind of dug into those, the software systems, and you're not sure how to navigate it, or you want to know a certain function, be sure to reach out to your regional community consultant to offer that assistance for you. We do have on the website also, there's a document on how would this benefit me. As you can see, some of the, and if you've already been, or if you've already been utilizing a shared service, a child care management software, you'll see that it will help you with billing, help you with ratios, help you with purchasing, a trend with that, families checking in, checking out, family communication, sending out just those mass notices. It really is to help you streamline some of those business aspects that you have on a day-to-day with running a child care program. So some of the potential services, and there are a lot of them. This is just just 2 columns of things that are possibilities for potential services through shared services. One that's on here that we've heard a lot about from providers is, of course, is staff recruitment and a substitute pool. That has been going on since I was in a child care program, and that's been years. So that is an ongoing need for that. So the shared services hub can help you with that, in that they could start developing a pool of other providers to contact. They would they would have them go through getting fingerprinted and all their KDHE requirements taken care of. Anything that is at all that upfront that we need to do to get people ready, qualified people ready to go and help you in the classroom or your family child care program. Might also be able to help you with one of the other things is joint purchasing that has come up. It's cheaper to buy in the bulk. So how can we make that happen for you? If you're looking at, you want to get marketing for your families or just staffing, that may be one of the services, one of those needs that you want to talk with your network hub representative about. So this is just kind of a repeat that this group, shared services network is a group of child care providers that are coming together to support each other and resources to make your business successful. And again, we do try to align these with our learning communities, because we want to have that point of contact, your regional community consultant that can help you with all aspects of your programming and help you with those shared services and, excuse me, the child care management software systems. So I think I have covered this with you, but I'll just kind of do a repeat. Again, if you're interested, you have a 14-month paid subscription through us. This all of the child care, excuse me, the CCQIS project is all funded through our partnership with Department of Children and Families. So they felt like this was an important aspect. We did too, as far as having that be available for you for your businesses. And then again, if you have questions or if you're just interested in getting registered, you can reach out to your regional community consultants. The vendors are also available to contact directly if you prefer to do that. They will also do an onboarding process with you. So on either side, on the vendor side and the regional community consultant side, we're here to support you. So this just kind of gives you an overview of Brightwheel. And this is the one with Playground. And again, these both are, you can see both of those slides and information on our website. So are there any questions at this point in regards to everything that I covered? Is there anything in the chat that we need to be, okay. All right, well, I guess that means we covered it, or we've just exploded your heads and there's just too much to think about.
Okay, so we are going to go into breakout rooms here in a minute, but I wanted to give you guys a little bit of information here really quick. When we go into the breakout rooms, there is, we're going to use Jamboard to give you guys a chance to kind of share some thoughts, some concerns, any feelings that you might be having about, sorry, I'm trying to monitor the chat box and multitask tonight, and I'm not so good at it, so I'm just going to focus on one thing right now. So we want you guys to be able to share your concerns, thoughts, anything that you might have regarding shared services. So we will be using Jamboard as a way for you to do that. So Jamboard, you can post in there anonymously. I am having a little bit of trouble accessing the link. Kim, can you send me a new one? For those of you that are not familiar with it, the plan is for me to give you a crash course in that here in just a moment. If you have a cell phone, it's not letting me sign in. If you have a cell phone and you try and click on the Jamboard link, it is going to encourage you to download an app. You do not need to download the app. You just won't be able to use Jamboard. Sorry, Kim, can you share the link? Because I'm having a really hard time with it. Can you pull it up and I can show them how to? I would say it's a Monday with technical difficulties, but it's a Tuesday that seems to be having a hard time. So on your screen right here is the Jamboard. And so each network service hub will have their own Jamboard. There's a button on the side that looks kind of like a Post-it note where you can see the arrow there. If you click on it, it'll pop up a sticky note. You can change whatever color you want it to, and you can post your thoughts on there. It does post things anonymously. So if you want us to know who is posting that, then you will need to put your name on there. So if you have any questions or concerns that we cannot address this evening, then your regional community consultant will know who to follow up with. If you are not comfortable using the Jamboard, if you are having a hard time or on a cell phone or a tablet and you can't post it without downloading the app, you can also post any questions, concerns, thoughts that you might have in the chat box for Zoom. If you want to send it as a private message, if you will, to the regional community consultant that you are working with so that they will see it and not everybody else will see it, that's fine. Just look for all of the regional community consultants have RCC next to their name. So when you click the drop down to be able to see the chat box, it should say RCC, like mine says RCC Rebecca Quigley, or everybody's moving around on the screen right now. I think I saw or Autumn has her name, Autumn Reiser, and then RCC. So you can send the message directly to her. That way, like I said, anything that we cannot address this evening, we know who to follow up with. The other thing I would say really quick is please make sure that you have posted your name or dropped your name in the chat with the county that you are in. That way we can put you into the appropriate breakout room. If by chance, once you get in there, you find that you are not in the right breakout room and you are not talking with who you thought your network hub representative was, feel free to leave the breakout room and go back into the main room and let Montana know, and she will put you in the correct room. Bear with us. There are 60 some odd people, I believe, on Zoom tonight, and I don't know if you guys have a whole lot of experience with breakout rooms, but they can be a bit of a challenge with Zoom, so we are doing the best that we can. So with that being said, we will go ahead. I believe,
Rebecca, I failed to mention, we didn't talk about that when we get to the breakout rooms, you need to go into these breakout rooms with the mindset of thinking about what you need for your business. You know, if you think about kids, you know, there or any of us, there's a need. I need to have water every day. I want to have chocolate every day. But you need to make that balance. What is actually the most high priority needs for you to be able to operate your childcare business, and what supports do you need? We'd like for the network hubs to come away, the representatives to come away with at least 3 needs that they can start focusing in on and digging into their service areas as far as who that service provider might be able to be identified as to meet that need that you identified within that breakout room. So I just wanted to kind of leave you with that start thinking on your needs, not necessarily on what you want to have.
Right, so I think that covers everything then. And again, once we get in there, the regional community consultants will kind of explain what's going on and introduce you to your network hub representative. And then we will have time to chat. To respect everybody's time this evening, there is going to be a time limit on how long we're in those breakout rooms. So like I said, if you have any questions or concerns that you feel like were not addressed, or if anything comes up after we're done, then feel free to reach out to your regional community consultant. We may not be able to answer everything this evening. We may not have the answers to everything that you asked tonight either. But we will do our best to get those back, or to find answers to questions that we can't answer this evening, or any questions that may come up down the road. So with that being said, I think we're ready for breakout rooms. So Montana, if you will go ahead and put everybody into the breakout rooms.
You betcha.
This is a part where you need like the Jeopardy theme song playing in the background, but I'm going to spare you guys and I won't actually sing it for you.
Since it's about 5 till 7, I would think that having a discussion ending no later than 7:30 should probably be able to get a pretty rich discussion from the groups. Again, as we just kind of center ourselves. And of course, as with any kind of meeting or conversation, I'm sure you're going to come up with some other thoughts after you leave tonight. Please make sure you send those to the regional community consultants. They will be in contact with their network hubs either this week or early next week, again, to just start generating those thoughts and putting things into action.
So I think it looks like we have a couple of providers that are still here. So if you'll bear with us, then I will help Montana.
I should be with Autumn.
Who said that? Donna?
Donna.
Okay.
I should be in my room. Please send me to my room.
This is
Okay.
Kristen Randall, and I should be with Autumn also.
Okay, give us just a second here. Danya, where I don't know where you went. Oh, she may have already been moved. Okay.
I think Tiffany Butcher and myself are supposed to be with Ann Gaskin.
Okay.
And I'm Holly Donaldson, by the way, sorry.
Okay.
I think I'm supposed to be with Danya.
Kathy Cohen.
Yes.
Okay. Sorry, this is kind of tricky to do here, so. Trying,
Yeah, it's definitely not easy to do, trying to sort out
bring-
everybody by county and remember who's where.
Okay, so we might try this a little bit differently here. So Tracy Schmidt, you're Dickinson County? Is that?
Yes,
Okay.
yes.
So you're going there. All right, so I have Angela, what county are you in?
Tammy Starkey should be with Child Start.
Okay, so Tammy Starkey, one there.
I'm with Johnson County. It was Angela. Uh-huh.
Okay. Anita, are you still in here? What county are you in?
Johnny. Hello,
Anita, what county are you in?
Johnny.
Shawnee? Okay, sorry. Okay, and then I have a Carrie. Oh, you're on mute, sorry.
I'm with Ann Gaskin, Child Start.
Okay, so yourself.
I'm Tiffany Butcher's with Ann.
Tiffany is with Ann as well. Okay. Sabine?
Gary County,
Okay, that's what I was thinking. You're with, there we go. And then Christina Randall,
Donna and Christina should be with Autumn.
Autumn.
Mhm.
Oh, that may have been the wrong one. Okay. Then I think I found Brenda Joe. Okay, what about Lorraine? And I apologize if I'm not saying names correctly.
Crawford County.
Crawford. Oh, I think she just moved there. Okay. Donna, I'm not seeing your name on here to be able to put you into one.
Donna Poor.
Well, your name's not listed. Did you log in initially with like 44? Like a number on your screen?
No.
Okay.
My name is Brenda. Oh, sorry. I finally figured. I'm Brenda Joe. I'm supposed to be with Ann. I'm with Child Start.
Okay.
I'm not a provider.
Okay, let me toss you in there real quick in South Central. Okay, so then I have 3 providers left. So I'm wondering, Donna, I think yours is showing up for some reason as a number on my screen. So which county did you say you were again?
Cherokee.
Cherokee. So you're child care ward of Eastern Kansas.
Mhm.
And then D, what county are you in?
Wyandotte County.
Wyandotte. So Family Conservancy.
Mhm.
And then Michelle.
Harper.
Where is I gotta look at where is Harper County?
I'm South Central.
So, oh, okay, Child Start. Okay, and then it should have tossed both of you into a room, but oh, there we go.
This one.
Yeah. Do you, Montana, do you see Donna's name?
I do not. I don't have any more that need to be.
Okay, I wonder if I can toss you this way.
I completed the form.
Well, but when we pull up the breakout rooms, for some reason, your name is not listed.
Oh, okay.
So like I can see you, I know you're here, but I can't see you on my screen to be able to toss you into a breakout room is the problem.
Okay.
Rebecca,
Yes,
this is Christy Randall, and you guys put me in Lawrence, and I should be in Crawford.
Crawford. Okay.
So they kicked
Sorry.
me back out. They told me to leave there and tell you guys where to put me.
Yeah. Okay, let me try this a different
I had
way.
an invite for Lawrence as well. And I'm like, nope, I'm not going in that one.
Yeah.
So you're both
in Autumn's group. We both
in
should be in
Autumn.
Autumn's.
Mhm.
Okay.
Yes.
And I don't see either one, like for
So
some odd
Rebecca,
reason.
if you go to participants,
Uh-huh.
you can go down to their name and go to move to.
I don't
Which
even
one do they need?
They need in with childcare, CCAEKS.
Okay. Maybe.
See if that'll work.
Am I supposed to go into Montana? Is that
No.
right?
No,
No, it's asking me to go in with Montana.
I don't know how
Coker.
Montana's a break, where Montana's a person.
Oh, it
Um,
says Montana Coker Shared Services inviting you to join the CCAEKS. Is that it?
Yes, that's the one
Yes.
you're going into.
Okay.
Okay, are you still here, Montana?
I am still here.